Agosto 2000.
22nd of August 2021. As Pupiavati said this morning, the meeting is a fact and we are here. We are all here in presence, and today we are going to speak about a topic with three distinguished guests, whom I thank for being here with us. We're talking about artificial intelligence in medicine. The meeting is a fact, and it deals with topics concerning reality, as in artificial situation. This topic had already been dealt with in 2019 in another session, and I will ask to show a meeting matching today's session, where Friar Beranti said something very interesting for today's session. So I'll now show a video which shows how the UK, which has a public health care sector similar to ours, has cut its costs in healthcare expenditure. So they have this interface, Babylon Health. So you see the doctor, bottom right, who is speaking with the patient, and she's been answering 4 or 5 questions on the mobile phone. Under the patient, you see some questions suggested to the doctor to be asked to the patient. In pink, you see what artificial intelligence makes. It reads the feedback and what the patient is saying. On the right, in real time, you can see all the dialogue between the two. Now, the patient doesn't know what to say because the doctor has talked about something very technical she does not understand, and therefore he explains to her, do you have some headache? And bit by bit, the machine is giving its diagnosis, and what is a troublesome headache to the patient, this is something very bad, but according to the diagnosis made by the machine, is the Meniere syndrome, something painful but not very worrying. Bottom left, you see in real time the clinical record of the patient, which is being updated in real time. And then you see some highlighted words which are necessary for the clinical diagnosis. HPI means personal diagnosis. I've got a headache. Then family, HX, is the family diagnosis. Even my mother had headache. And then you have the social diagnosis. All the people in the neighborhood have a headache. So is that only connected to me or something connected to everyone? So the doctor says, yes, I do agree with the artificial intelligence. So you have the Meniere syndrome. So all the dialogue is transformed into the clinical record. The clinical record is updated. And then in 30 minutes, the drug that has been prescribed can be found in the pharmacy nearby. Therefore, the doctor explains to the patient, okay, symptoms can be bad, but don't worry, you just take this painkiller, and the situation will be solved. Okay, so you can understand how this is perfectly in line with today's session. I will introduce the 3 guests now. Thank you very much to Dr. Montomoli. He is an anesthesiologist. He operates here in Rimini, the city hosting the meeting for the past 42 years, and was an epidemiologist in Denmark. And engineer Mr. Bizzarri, CEO of Umbria Salute, and Mr. Forti, doctor, director of digital health and well-being at the Bruno Kessler Center. I will ask them to tell us, in the context where they work, what is their experience, and what will happen in the future in medicine and healthcare with the impact of artificial intelligence. I'll give the floor to the doctor. Thank you very much for inviting me here and for this very interesting session. I don't know how many of you received the mail of the last statement by Elon Musk. On the latest news on artificial intelligence, Elon Musk has announced that next year it will be launching the first human prototype, Shopping for Us. So in the healthcare sector, things work a bit differently. So let's see the first slide. There's in the healthcare sector, the patient, the one having the information that needs to be recorded. Then there's hospitals and primary care. So you can see here the slide. Then computerized clinical records, which are created and managed by outside parties, and artificial intelligence models collecting data, which must be of very good quality in order to create models that do work in real life. The main goal is to close the loop, as in to improve the quality of care, the patient's diagnosis, and the quality of diagnosis. This is what we aspire to. This is what we're working for. As in, the main aim is to have all data available, very high quality data available, because if we put in an algorithm a poor data, then we're going to get poor results. Artificial intelligence does not transform poor data into good results. What we are lacking right now is the connection between all the different entities. At present, I am working on one specific dimension, but we want everything to be connected. So we're dealing with predictive diagnosis models. In particular, I'm dealing with intensive care right now. We've all been suffering from COVID, and we're all working on COVID. We still know very little on COVID. We cannot yet predict the best possible therapy and the prognosis. And we are working on models that can anticipate, like we use blood tests. Artificial intelligence can tell us in advance if in 3 days with our therapy, with our treatment, the patient will be better or not. But in order to do that, we need very high quality data. So we are creating international databases with standardized data where a model speaking a language inside a database can be replicated and implemented in another database. Because if we use different languages, then a model cannot be tested anywhere else. Also, artificial intelligence is helping us in simulation and training. For example, AI can create cases of patients whereby we can train, on which we can train our analysis skills. This is the clinical decision support system. It's like an algorithm that can help us in analyzing the many data that we have in order to have an easier and a faster diagnosis, and in order to provide the best possible treatment for that patient. This is the medium-term goal. It is important to identify what can now stop, block, kill the artificial intelligence. Data are fundamental. The managers, organizations, all healthcare stakeholders must be farsighted and must now collect data, because data can then be useful in 20 years' time. This is what I learned in Denmark. We've been collecting data since 1978, and now there have been data for 50 years, which was unthinkable 50 years ago. good data means good quality. Poor data means poor quality. And the ethics is of the utmost importance. We have to pay attention to data, but patients should be used by these models. If you collect a model which is only a byproduct of information, then the information is not correct, it's poor, and we have to make data available. Also, culture is of the utmost importance. So that means not just engineers, but also models who need to understand how models work. They must provide feedback to engineers that have to build a clinical, meaningful model. And we need to understand what is ethical and what is not ethical. All that is very important, and we need to discuss about all these points in order to fully and promptly react to the problems immediately. But we couldn't do that on our own. We wouldn't be able to work on our own to create models. We need to work all together because data must be collected from different professionals. For example, I'm very happy to collaborate as I work in the local healthcare unit in Emilia-Romagna. We work together in the healthcare unit. We work with a working group on big data and artificial intelligence in order to create national databases to have different data that can have predictive models, good predictive models for specific patients. With the University of Zurich, an international database was created. More than 90 centers have been collaborating for the creation of that database on many patients in order to understand the possible future problems, potential problems that some patients may have. And then engineers are also very important. Engineers have the right skills in order to develop very good models. Thank you once again for inviting me here. I hope I've given you a broad outline of what we're doing right now and what we'll be able to do in the future with artificial intelligence. Thank you, Doc. Before giving the floor to Mr. Bizzarri, I will underline 2 points here. First, we all can give our own contribution. We are all now participating in the national healthcare system, not just by paying taxes, but also by providing our information. So everything we produce in terms of information is provided to the national healthcare sector. This information is still not fully owned by the national healthcare system because it is too often owned by only specific entities. But maybe we'll go back to that later on. And then our guest talked about the system. And now I'm asking engineer Mr. Bizzarri and then Mr. Forti, doctor, from 2 different perspectives. How can the system interface with artificial intelligence, which is increasingly common in the Italian healthcare sector? Thank you for inviting me here. I am the CEO of Umbria Salute, and I am a member of the working groups redesigning the system. Umbria is characterized by 2 distinguishing figures. One which is now being redesigned, as in the regional health plan. Also, the Umbria region, as all regions, has many projects that have been sponsored by the National Resilience and Recovery Plan, which allocates significant resources. Also, there's a need to redefine Umbria Salute. I will give you 3 examples of how it is possible to make artificial intelligence useful for citizens. Now, let's start from the primary care, where we can use predictive models in order to predict, for example, the future problems for patients' complications. For example, in the case of diabetes, with artificial intelligence, we could anticipate, predict 2 or 3 years in advance possible complications of diabetes patients. If we know that, we can also change treatment, prevention, and also change the treatment of specific patients. That would enable us to manage patients in a very advanced way by using artificial intelligence. There are also some other examples. For example, diabetes number 1, which is mostly common in hospitals. We may also reduce resources, as in no longer making visits, organizing visits every 6 months, but organizing visits as needed. Maybe monitoring could be done through an app, and therefore we could decide through monitoring whether a visit could be made remotely, which was very common during the lockdown. But that must be an enabler for the future. Also, we need to talk about prevention. Prevention can no longer be as it was in the past. We will need to adopt a good and healthy lifestyles. So chat boxes will be used in order to achieve our health objectives. My challenge is to redesign processes and organizations so that technology becomes an enabler. To conclude, and please show the slide, I'm going to focus on one of the risks that we might have. And this is represented by the equation. The old organization summed up to new technologies leads to an expensive old organization. So in that case, artificial intelligence could not be used in the most effective way. So we need to use artificial intelligence in the proper way, and we need to change things so that professionals can work with artificial intelligence effectively. That means artificial intelligence must help and accompany them in their job, not replacing them, but just helping them.
Our speaker has given us very interesting food for thought. We're going to address it in our second round. Let us leave the floor to the third speaker. So good afternoon, everybody. Thanks to the organizers of the meeting. Thanks to the chairperson of this session. So very briefly, AI is a very wide topic. We can address it from many points of view. Just to contextualize what the perspective I would like to share with you, I would like to talk about a public health system. And I'm doing so because I work at a foundation, but in Trentino Alto Adige, I work in close collaboration with a competence center with doctors and nurses of the Trento Health Company, as well as with people working for the local councillorship. So together with all of these people, we're trying to go towards this direction. Furthermore, I would like to address a topic that Giancarlo has already hinted to, which is prevention. I'd like to ask for the first slide to be shown. Prevention is very important from a number of viewpoints. First of all, in terms of research and impact. What do we mean by prevention? First of all, we refer to people's behaviors. So behaviors which have to deal with people's lifestyles as well as their mental well-being. As you can see, there is a pyramid in the middle of the slide, and you see citizens. The meaning of the pyramid is that it is organized based on different health needs. At the base of the pyramid, you see healthy people. Their correct lifestyles and their correct behaviors are very important because they will have an impact on the development of their future health situation. At the middle of the pyramid, you have people at risk who already have some conditions, and then at the tip of the pyramid, you have people who are ill. And prevention has to deal with all the individuals that you see in the pyramid. So primary prevention, then secondary prevention when you're dealing with people at risk, and then prevention for people who are already ill, whereby prevention is already important for the progress of the disease. Before illustrating a case study that we are currently working on, as you can see, there are three main elements on the left. Their goal is to help us contextualize this topic. The first topic refers to the National Health Service. It goes without saying that the National Health Service currently lacks personnel. Also looking at future predictions, human resources will be needed in this field, and this is very important because at the same time the request for services is on the rise, and this is linked to the aging population. The second element refers to citizens, so any one of us. This is a particularly important aspect because we are all aware of the fact that the introduction of sensors and apps is currently promoting citizens' active role in the protection of their health. And this means that the very same patient generates data that will be fundamental for the health system. Some people predict that the data that we will generate every day will be more numerous than the data generated by hospital systems on citizens. And then there's a third aspect, which pertains an aspect that was not there a couple of years ago. That is to say, the fact that big tech and big pharma companies are currently establishing alliances, and they're entering the health system to provide technology as well as to provide services. So as we are dealing with increasingly interconnected citizens, big tech and big pharma companies have the possibility to, in a way, kind of replace, in a way, the National Health Service in providing services. So the title I wanted to give to this title is Artificial Intelligence for Prevention. Is this an option or a necessity for the national health system? From our viewpoint, it is a need. It is a necessity. However, we would like the state, we would like the public sector to be in charge of the governance of this, because health is a common asset, and it cannot be based only on business-related logic. So on the right, you see some of the tools which are particularly important in dealing with prevention. This has nothing to deal with the initial video of this session. In other words, we're talking here about apps that refer to the assistants, so personal assistants, chat boxes. Their aim is to monitor and motivate, as well as to dialogue with citizens in order to induce them to adopt correct lifestyles. So to draw to a close, let me give you an example. we believe it is very interesting to think about the use of these systems, so AI systems, applied in the first 1,000 days of a person. This is particularly important as an example, because this does not relate to just one person, but a whole family. So, for example, a pregnant woman during the 9 months of pregnancy, and then the baby and the child, and his or her entire family when you deal with the first, with the needs of this young person in the 2 years of their life. We all know that, for example, food behavior in the first 1,000 days of this baby will have an impact, will condition the life of the child. So the idea is to sponsor, to promote the use of chat boxes, of these personal assistants who can support women in the first 1,000 days or in the lives of their children. So we are currently envisaging personal assistants with which have a number of different roles. For example, they can provide recommendations on correct nutrition and as well as physical exercise and mental well-being. What's important is that we're dealing with personal assistants who can be prescribed by the general practitioner, or they can be activated by women as well. Thank you very much. So, as I said at the beginning, we are here at the Rimini meeting, and the title of the meeting is Meeting for Friendship Amongst People. So, this discussion for this discussion, we believed it is interesting to show you again excerpts of a session that took place a couple of days ago on artificial intelligence. Let us watch the first contribution. There is a very important aspect of man that AI does not have, which is intuition. AI can work because it is programmed to do something, or because it learns from a number of examples. Intuition does not stem only from this. Human intuition, for example, when you come out with an idea, that of course depends on anything that you've experienced and lived, but it's not only that. Intuition means acknowledging. It is identifying a link between what you have in your hands and something that comes out in your head. Professor Magazzeni was telling us that there is, like I said, an aspect which is intuition that AI does not have. So that refers to intelligence, but that is followed by action, and Magazzeni comments also on this. I often travel for work. I fly for work, and not long ago I had the chance to pose a question to the captain of the plane where I was traveling with. During a flight, the pilot controls the plane only for 3% of the flight, so basically that's nothing. But that 3% includes landing. So a couple of minutes before landing, the pilot deactivates the automatic pilot and takes the manual control of the plane. So I posed the captain the following question: why do you take on the responsibility and also the risk of landing, of having the plane landed manually? Because actually the pilots decide to take on the risk, even if the plane knows how to do it. So why do you take on that risk? And the answer given to me by the captain was the following: because we need to keep ourselves trained. Because if the self-pilot, the automatic pilot, does not work, we could have forgotten what it means to fly a plane. So Professor Magazzeni talks about action. However, the title of the meeting this year is the title to say I. So you have to face artificial intelligence exactly as you face reality. In the same meeting, Mr. Esposito added some additional remarks which we believe are particularly useful for today's session. So from a philosophical viewpoint, the problem of this uploading our minds into a machine. If we become, as we become a machine, then who becomes what? What's the subject of change? Are we talking about a new identity? Are we talking about an avatar? Are we talking about something fictitious? So, where does the natural identity of the self end if it becomes just a machine? Well, I would rephrase the problem in this way. This process, which pertains the possibility to kind of calculate the world that has to deal with artificial intelligence, identifies the I, the thinking self, as some kind of a managerial function of information. I'm not saying that the self is not capable of managing cognitive functions. But what I'm saying is that in this case, the cognitive function is such that you no longer need to suppose the very same presence of a thinking self, as if the thinking capacity of the self kind of eliminates the very same topic of our thought. In other words, the results, the outcome of our thought makes the thinking self superfluous. So the thinking self is reduced to a simple procedure, to a humble procedure, and to the ability to calculate, completely losing one's personal identity.
Scusatemi tutti questi frammenti, però ribadisco.
Apologies for all these excerpts, but we believed they're particularly useful to ask a question we should all ask ourselves. So this is a question that pertains all of us, not just a doctor, not just those who are in charge of digital services in a region or of a foundation. However, I would like to ask all of you, as human beings, as citizens, I would like to ask you what kind of questions artificial intelligence poses to you compared to your daily work. I would like to answer by highlighting three main things. First, if we are to travel from Milan to Rome, we can choose to go by a Topolino car without airbag, without additional features, or a new car. I mean, driving a Topolino could be fun, but maybe it's safer to use a new car. So if I can have a model, a predictive model that tells me, for example, what COVID patients will get worse in 63% of the cases, for example, out of the classical model maybe gets the right answer in 63% of the cases. So if it were me, if it were one of my relatives, my father, I think I would go for the best performing model. So if we can adopt well-performing models, why not use them? Then there's a second point to highlight. That refers to a moral issue. For example, during my lyceum years, I was examined on Nikola Tesla, who used to say that science is a perversion unless its ultimate goal is to improve the conditions of mankind. So if we write down a research project, the answer to this question, will it be something that we do just for our personal curiosity, or will it be something that will improve the condition of mankind? So the way we use the tool, are we using the tool to improve the conditions of ourselves or of the other patients? So here too, you can easily decide whether you would like to use this tool or not. And then a third point. A couple of months ago, there was a contribution on JAMA, who is one of the most important journals, American journals of medicine, which stated that out of 8 hours of work. A doctor spends about 5 hours in front of the PC. My personal example, last night, there were 2 doctors, 15 patients, and I was also called to the infective diseases ward to visit a patient. I had 5 minutes to visit the patient. I had to open the computer to actually check 3 days of exams. I had to open the chest x-rays of the patient and decide whether the patient was getting worse or not. And then I also had to check what examinations he had undergone over the last 10 years to check if there was something that could induce me to think whether the patient was getting worse or not. If out of that 60 minutes, 45 minutes could have been spent aside at the bedside of the patient to visit him and to understand what's the best option for him or her as a patient, and then maybe go to the computer and have some kind of a summary of the information I had to read, and then just have a piece of information telling me that maybe the patient needed to be intubated. I mean, if I could have had the chance to have the tool, I would have used that. And that happens every day in the resuscitation ward. I mean, I spend lots of hours at the PC watching, looking and reading documents. So these are the 3 questions that I asked myself, but these are the 3 hints I would like to share with you to answer this question.
Dr. Bizzarri. I want to say something on artificial intelligence. It's really fascinating. I'm here in professional here dealing with patients. And I know that, I understand that there is an opportunity to make artificial intelligence an enabler, and so that it can help a change in the system. And this is a very fascinating challenge. At the same time, I'm always asking myself what I can do so that this can really happen in practice, because we've understood that this is not a technological problem. We do have the technology. It is a cultural problem. It is a problem of organization, so to speak. So every day I'm asking myself what I can do for that. And each one of us has to give his or her own contribution to the system. And I will give you an example. Without talking about processing, delivering services to citizens. In Umbria Salute, we have the original booking center for the healthcare sector and the regional procurement center. When we start doing the procurement to buy, for example, systems for radiology, for example, or for digital pathology, if we have the possibility to buy machines which are provided with artificial intelligence, we will never have the opportunity to give professionals the ability to use them at their best. So, in my role, I can give my own contribution, and I can change processes. And also to re-engineer processes so that artificial intelligence can be an enabler, and to use it in the best possible way and in the most intelligent way. I'll make a couple of remarks. The first one on data. As often said, data are the main engine for artificial intelligence and for systems, for AI systems. The data produced through different apps should be data that should be controlled by each citizen. So each citizen should be able to have access to those data at any time and should be able to control them, which is not the case today. In 2021, a document by the WHO was published on the governance of AI in the healthcare sector. Point number 1 of 6 ethical aspects is the control of autonomy, as in healthcare operators and citizens should be informed of, for example, whether they are being provided with a service based on artificial intelligence, if that service has been certified, if that has been clinically validated or not. And also, they should have the opportunity to activate it or deactivate it, or for doctors to use it as needed. Also, there's another important aspect on data. According to ethics, citizens must have the control of their own healthcare data, health data, those produced by the healthcare sector and those produced right now, at present, are controlled by a sort of parallel world, which is now influencing our lives. I'll make a second remark. I'll go back to the pilot on the plane. This is a very nice metaphor, and this is a very interesting metaphor also for the use of AI solutions. It explains many things. It explains, first of all, the fact that, as you all know, some years ago, people were afraid that pilots would be replaced by autopilots sooner or later, which was not the case. There are always human pilots on planes. And that will continue to be the case in the healthcare sector for the next 10 years. Also, the pilot, in our case the doctor, uses the system when he or she needs it. If he or she needs it 97% of times, okay. To conclude, I don't remember who said that, but this is also a very common sentence. There's a famous American radiologist who once said that radiologists will never be replaced by AI, but the radiologists who will not want to use artificial intelligence will be replaced. Thank you very much to you all for speaking about artificial intelligence as a tool. However, oftentimes, this tool is considered as a partner of clinicians, of the healthcare sectors, of healthcare professionals. Bismarck used to say that in the relationship between patients and doctors, it's like people are in a desert island. No one interferes. As in, now it's a sort of archipelago, not a desert island, where doctors actually need their colleagues, and also clinical engineers and other professionals. This is where artificial intelligence and the digital world come in. My last question to you all. In your experience, this multidisciplinarity must have a clear mission, as in the sick patient and his or her families. How can all the professionals be combined to work together for the well-being of patients? How can artificial intelligence interact in the healthcare sector, which is a very complex world, both in hospitals and in primary care? Well, I hope that artificial intelligence will be able to be used in a multidisciplinary environment. Oftentimes, we only speak about multidisciplinarity. Since artificial intelligence was not initially used in the medical sector, now professionals needed to open up to other professionals, as in engineers, philosophers, experts in ethics. Otherwise, we're not able to use artificial intelligence as a tool. So hopefully, I hope that artificial intelligence will be able to give us the opportunity to be really multidisciplinary with other professionals. Yes, your question on multidisciplinarity is very interesting. In the future, I will also have some virtual assistants among my colleagues. They become useful to automate some things that I don't have time to do, like, for example, education, motivation to patients, certainly not a diagnosis or treatment. So I imagine a world where among all my colleagues, I will also see some virtual assistants. Also, in this multidisciplinary context, AI could be useful if doctors can provide tailor-made treatment to their patients. So artificial intelligence can be useful to better plan the resources to provide good treatment to patients, so that treatment is really tailor-made, based on patients' needs, also based on AI algorithms, which must be considered very carefully. However, if algorithms have been certified and clinically validated and developed, designed with doctors, I think that they can be very useful. Mr. Bizzarri, following up to what Dr. Forti said, he talked about resources. As we saw in one of your slides, what is the impact of this revolution, which is already underway, has an impact on the use of resources, which are scarce? Well, as for the use of resources, we see that they're quite scarce in the healthcare sectors, but we also lack professionals, I think. 30% of doctors will be lost in the healthcare sector in 2 years. But this is a tremendous opportunity to redesign the systems based on a common vision. And based on my experience with COVID, COVID has transformed healthcare authorities, which by definition are very effective, but they're not very agile or very smooth. We've managed during COVID to create intensive care units in just 5 days and to make it work. But the aim was a common one. I think that teamwork, the multidisciplinary approach, multi-professional approach can only be achieved if managers can transfer their vision on healthcare and on how we want the organization to be. So redesigning organizations is important because that will lead to tremendous change. As happened during the COVID, we need to have clear in mind what we want to achieve. This is the challenge because, let's say, 10, 15 years ago, designing an organization 5 or 7 years ahead implied reproposing models used in the past. Today, we know that the vision has to be a new one. We should not replicate what we did in the past. So the real task of managers redesigning organization for the future is to have a clear vision on the organization that will need to that will be working in the future. So even with scarce resources, organization will need to take care of patients, even through technology. Only this way, artificial intelligence will be an enabler. So thank you very much to all the guests, Mr. Bizzarri, Mr. Forti. and Mr. Montomoli and Mr. Costantino Esposito and Benenti that yesterday was with us at the meeting, and last but not least, Professor Magazzeni. And first and foremost, thank you very much to the meeting. And I invite you all to thank the meeting by participating in the meeting, not only by being here, but all those of you who are here and who are connected from home, please donate now in order to contribute to this event that is unique in the world and probably in the world here in Rimini, so that this dialogue can continue in the future. Thank you very much to you all. Thank you very much to the meeting, and see you very soon.
Thank you.